Hey, Dr. William Song here from Omni Aesthetics. Today, I want to introduce you to a friend of mine. His name is Ed Hemberger, and he has a practice called the Hemberger Method of Structural Integration. And what's really neat is that with his techniques, we can actually help people change their postures. He's been able to show that you can get long-lasting improvement in posture and help you look and feel much better. So Ed, can you really improve somebody's posture with your technique?
Yes, I can. At Hemberger Structural Integration, what I generally do is work on their fascia. A good way for me to explain it to you would be if you wash the skin off of a chicken, take the first layer off, that white gooey stuff is called fascia, and that held the chicken's muscle to the bone. In humans, however, if the fascia gets too tight, it pulls you forward and down, and your shoulders come down, your neck becomes forward, especially if we're living in the technical age of computers, which is sometimes called turtleneck, where your neck is forward. So by loosening that up, you're basically allowing the body to realign itself.
So the fascia is that really tough stuff that's surrounding the muscle, like the meat when you're looking at the chicken meat?
Yes, it's essentially holding your muscles to the bone.
So what happens over time? Do you get too much fascia, or does the fascia get too tight, or what's going on?
The fascia essentially gets way too tight, which is in most people, which is why their posture isn't really where it's supposed to be.
So the fascia is actually preventing the movement of the muscle.
Yes. If you stay in a position for too long, the fascia is going to hold your muscles where it does not belong. And you do have 650 muscles, 206 bones, and 350 joints. So by loosening up the fascia, your body is surrounded by fascia. So it's surrounding your ears, your eyes, your mouth. It's completely covering your whole body.
So when your mother told you to stand up straight, so there was some validity to that, because if you don't sit up straight, if you slouch, your muscles are going to get trapped that way by the fascia.
And exactly. And when your fascia gets trapped by the muscles, which is a great point that you're saying, you end up being frozen in that position. There's other modalities like physical therapy and chiropractic, which are fine, but it's usually short term. It really has to be done manually. So I use my hands, my elbows, my fingers to really put everything I do deeply in. I work deeply into the fascia to loosen the fascia.
So tell me if I'm correct. My understanding is that when you're doing physical therapy, you're stretching that fascia so that your muscle can move more freely, but what you're doing is a little different.
What I'm doing is loosening up the whole body, because the fascia, it really starts on the top of your head and goes all the way down to the bottom of your feet. If you have golfer's elbow, you're just loosening up the fascia around the elbow. I'm essentially loosening up every part of your body, which would be a 100% myofascially being released instead of just one area.
So when I came to you for my sessions, I was a little surprised that you wanted to treat the whole body and not just the areas where I was concerned about. And so explain again why you need to treat the whole body and not just, because if you go to physical therapy, they're going to treat the area where you're having the issues.
Right. And as much as that's good, the only problem is it's usually not that long lasting. It's short term, because if you have a shoulder injury or your neck is bothering you, you're just really concentrating on that area and you're not really releasing the whole body. There's what's called the superficial back line, the superficial front line, and that front line goes from the bottom of your feet to the top of your head, and the back line would go from the back of your feet to the top of your head. So that said, in answer to your question, sometimes if you have a back problem, sometimes I'm not going to just think that it's coming from your back. It could be coming from some other place on your body.
So if you just fix one area, it's only going to be a matter of time before the dysfunction in other areas.
Totally great question, because yes, because your whole body really needs to be loosened or connected. Your body, your fascia is connective tissue, which is the same, goes from the bottom of your feet, like you just said, to the top of your feet. So by loosening all that up, it's basically allowing the body to improve its posture.
Now, the treatments are pretty intense, and it really felt like you were actually ripping apart the fascia. So what exactly are you doing?
It's a very good point, and people ask me that every day, that does it hurt? And sometimes it can hurt. Your fascia sometimes gets like Elmer's glue, and if you put Elmer's glue on a piece of paper and you come back 2 hours later, it gets very thick and hard to move. That's how sometimes your fascia actually gets, especially if you get older, it gets harder and harder to release the fascia. So sometimes it can hurt. There's no question about it. But the benefits are long lasting, where once you're done with the 10 sessions, it is a 10-step protocol where every part of the body is getting released, as opposed to, like I mentioned before, you're not just releasing one area of the body, as you mentioned with physical therapy.
So, Ed, you once treated a patient of mine, and I was very impressed. This was an older lady who was bedridden, and she was so contracted that she couldn't even lift her head up to eat. And I remember you started working on her, and we got her to the point where she was able to sit up, and we can actually see her face for the first time after just a few weeks of treatment.
I do remember that. I remember her. She was actually bent over completely, and it was just by loosening up her fascia on the whole side of her, because she was so bent over for so long.
Yeah, it had gotten so bad that we were contemplating putting a feeding tube in her because she physically couldn't lift her head up to eat. And it certainly made a huge difference in her life. And I know most people you treat aren't that far gone, but if we can help her, and that's what really impressed me. And in my mind, I thought, if we can help this person, think of all the people who just have a little bad posture, and the treatment can really make a difference.
And that's really my main focus, to kind of help people's posture one person at a time.
People don't realize that this is a treatment that is available, and the results are long lasting, right?
Yes. Depending on, once you go through the 10 sessions, you're really done with the 10 sessions. You don't have to come back every week. You don't have to, it's not a regular, like other modalities. When the 10 sessions are over, you're done. However, if you have an accident, you have a skiing accident, or something happens, you might need to come up for a tune-up.
Yeah, so that's really incredible, because most treatments like this, you have to commit to doing it twice a week for years, and I was surprised that you told me that I just needed 10 sessions. And I know people sometimes expect treatment one and done, and some people might think that 10 treatments is a lot. But if you compare these to some of the other things that we use to treat this kind of stuff, like physical therapy and chiropractic, you're talking about a long-term commitment. So 10 sessions is really not a lot.
Optimally, it was designed to be done on a weekly basis because when the fascia gets loose, you want to keep loosening it so it doesn't get tighter again. Thereby, your body will adapt to it and it will get released.
So when I had my treatment with you, it was actually a few years ago, and the benefits have lasted, but I didn't have to keep doing it for every week for the rest of my life. So that, I'm busy, I don't really have time to do that. So that was a very
that is some of the really good benefits of structural integration, which I think people really still don't understand, because it is alternative, and a lot of people still don't understand what structural integration is.
I think people are going to start to hear a lot more about it, because if the results are as good as the results that I've gotten and the patient that I've sent to you have gotten, I think once people find out, the word will really spread. So I've heard of a treatment called Rolfing. Is this something like Rolfing?
This is Rolfing is a form of structural integration, yes.
And your technique is called?
Hemberger structural integration, because my main focus is to improve people's posture.
Dr. Thomas Finley in New York had done some studies with veterans where he was actually able to prove that they actually had increase in height after going through a series of treatments. Are you finding similar results in your work?
Yes, I'm doing my own pilot study right now, and I've already helped most people after the 10 sessions are either half an inch or up to 3/4 of an inch taller after the sessions. So that's in my own pilot study right now.
That is incredible. So you can actually get taller. I mean, you certainly look taller from improving your posture. But do you think that by releasing that fascia from the bones, you're actually allowing them to?
There's no question about it. You are by releasing the fascia, you're basically creating space in the body, so the body can go back to where it's really is supposed to go to. It feels as though by the time you're 40 years old, everyone's body really goes out of alignment. It doesn't stay because of accidents and bad posture.
So what are some of the other things that structural integration can help with?
Chronic injuries, lower back pain, carpal tunnel syndrome, sciatica is a good one, tension, headaches, anti-aging, rotator cuff injuries. It could help with lots of injuries.
So it helps with the pain?
Yes, it helps with inflammation. I've worked with the New Jersey Symphony, the Rutgers football team, as well as the New Jersey Ballet, and they've all found it to be beneficial.
So these are professional athletes and dancers who are constantly putting strain on their muscles and ligaments and...
Yes, dancers, especially feet and legs with the New Jersey Ballet. The symphony is basically repetitive, playing the same the instrument over and over for hours and hours. So all of those need to have, it's a good idea for them to have structural integration, as well as some of the football players at the Rutgers football team.
So thank you so much, Ed. We are honored to have had you as a guest today, and we look forward to learning more about your work. And if you're interested in finding out more about the Hemberger method of structural integration, you can visit his website. It is the HembergerStructuralIntegration.com. So the website, is that correct?
Yes.
Hemberger
Yep.
Structural Integration.
And they can reach me at 973-462-3112.
Okay, thank you very much.
Thank you.